introduction and establish the rapport. Okay. So what you have to do, you have to introduce yourself, and you have to talk to the patient herself. She is 30 years old, Mrs. Jennifer. She was admitted yesterday with paracetamol overdose, and mostly this scenario is coming as a suicidal attempt. And she wants to leave the hospital, and she is telling that I want to go from the hospital right now as soon as possible. I do not want to stay here anymore. And if you want me to sign the Dharma paper or Lama paper, I will sign that paper also. I want to leave. It means she wants to leave the hospital against the medical advice. So what you have to do, your task is you are doctor in the ward. Nurse called you and informed you about the situation, and you came in and you are going towards the patient now. You reach to the patient, you introduce yourself, and obviously this patient is aggressive patient, and she wants to go. So when you will go to her, you have to talk to her like this. Hello, Mrs. Jennifer. I'm Dr. Shaikh, one of the doctor looking care of you or taking care of you here. I understand that this must be a very difficult time for you. Would it be okay if I could discuss with you some important things as it is happening? So what she will say? Most likely she will say, Doctor, I don't want to talk to anyone and I want to go. So she will say like this, I want to go, doctor. So your answer should, your approach should be like this. Can you please tell me what is making you to want to leave the hospital today? May I know, are you not satisfied with the hospital services, or you have any other concerns that I can solve or I can help you? So whatever the concern she is showing to you, you have to you have to give the solution very politely. But she may say you, doctor, I don't want to stay anymore in this hospital. I want to go now, and this is my personal decision, doctor. I want to go now. So what you will say? You will inform. You know that this patient is suicidal attempt patient. So you will inform her, Mrs. Jennifer, whatever discussion we are doing here, it is highly confidential. I can reassure you, it will remain highly confidential. And this you have to say at least 2 times or 3 times in next 1 to 2 minutes. In next 1 minute, you can say. So 2 times, if you will say in the exam scenario, she will be okay and she will be trusting on you. So what you will say, Mrs. Jennifer, and you have to say with the sympathy and empathy. I know you are suffering a lot, and I can tell you that whatever the discussion we are going to do here, it will remain highly confidential. You can trust me. So then after saying second time, she will be okay with you and she will start like this. Doctor, this hospital is not a good hospital. The nurses, they are judgmental. They are showing me like they are seeing towards me like I'm a criminal. So you will address this concern. Oh, I'm sorry about this. I will take care about this issue immediately. I will talk to the nursing head. Nobody should do like this. Nobody should behave to you like this. So this problem is solved. The second thing she will say, doctor, this hospital is not clean. You see the bed sheet is very dirty. So you will approach like this. I appreciate Mrs. Jennifer. Yes, you are right. And I will solve this issue also and will give you the new clean bed sheet and we will keep your room very clean. So this is second issue is solved. Maybe third issue, she will say to you, the food is not good. Okay, so we will provide you the better food and we will keep you under observation. So these are the 2 or 3 issues she will bring to you, like to gain your confidence again. So, but then you will approach to her, Mrs. Jennifer. I would like to highlight that the condition you have, it is really very serious. It could be catastrophic in next 24 to 48 hours. No, doctor, I'm fine. I'm not having any symptoms. I appreciate your concern, Mrs. Jennifer. Actually, whenever we have this medicine, if somebody takes this medicine, in the initial 24 hours to 48 hours, he or she does not feel anything. But the medicine is slowly and gradually affecting your body, especially your liver. So we have to keep you under observation and we have to provide you best possible care. So it is not safe for you to leave the hospital. No, doctor, I want to leave the hospital now. May I know why you want to leave the hospital? Doctor, I have to take care of my mother. I have to take care of my children. Okay, so we will provide you the social support. Is there anyone around you of your family member who can take care of your mother? We can request him to help you, or who can take care of your children, who can take care of your children. So you will be getting the best possible treatment and you will be okay and you will be secure here and your children and your mother will be secure there. So like this. Okay. Then she may say to you, doctor, uh, then you have to try to find out why she attempted this. So after that, you should say, would you please give me chance to ask you some questions? Okay, doctor. Now you have got the confidence level of her and she is trusting you. Okay. So after all this discussion of 2 to 3 minutes, you will get the confidence. Then you will ask her, would you please tell me what medicine you took and how many tablets you took? And if if you believe me, I told you before also that you can trust me. It will remain highly confidential. So why you did this? Okay, and to assess the severity of the suicidal attempt, we have to ask some more question to her, and she will give you the answer. Okay, before attempting this, taking this medicine, did you write some final notes? If she wrote some final notes, it means she was serious. Okay. The second thing, did you close the door? Yes. So it is serious attempt. Okay. The second thing, and the third thing, did you inform anyone about this? If she did not inform to anyone, it is serious attempt. Okay. The fourth thing, did you resign from your job? Yes. This is another serious attempt. Okay. Did you like close your bank account or something like this? Whatever that, if you remember 5, 6 questions during the exam, only 2 to 3 will come to your mind. And if you believe me, if you will ask 2 to 3 questions to assess the severity of the suicidal attempt, examiner will give you the full marks and he will take you as a good candidate that he knows the depth of this communication. So to assess whether she was serious in attempting the suicide or no, you have to ask 5, 6, 7 questions like this. And then another question you can ask, did you attempt before also? Okay, if she has attempted before also, then it is also the serious issue. Okay, and then you took only the paracetamol or you took some other medicines also? So if she took some other medicine, whatever the medicine available in the house, in the home, it means it was a serious attempt. And how you took these paracetamol tablets, with the water or with something else, like alcohol or something like that. If she has taken the alcohol also, this is another indicator that she has done the serious attempt. Okay, now these all you assessed and then you will ask her. So I told you the seriousness of your problem and you have to stay in the hospital. No, doctor, I want to go home now. So could I ask you one question? If you go home, is there any plan to do any attempt again? So she may say, why you are asking? Or she may say to you, yes, doctor, I will do it again. So then you have to say, Mrs. Jennifer, your life is very precious. Your children are waiting, okay? And your mother is waiting for you. And this life is very precious for you. And I would suggest you, I will recommend you, better to say, I would recommend you, you should take care of yourself, you should take care of your family. And why it happened, we will try to manage it. If it was like a husband who did something wrong, if you allow me, I can arrange some meeting I can explain him and I can do some efforts to patch up. Or might be the boyfriend, he did something or something else, whatever the situation is. Mostly they are bringing the scenario like the partner left or the husband did something. So they are attempting this. So try to solve and you have to do like this. I will try to arrange a meeting to will do the patch up. Okay. So in this scenario, she will not listen to this level also. She will say, no, doctor, I want to go now. So the final hidden agenda in this scenario is you have to inform Mrs. Jennifer. I believe you are not in a sound state of mind. You are not in a state of mind where you can make a sound decision or the right decision. So I have to call the psychiatric doctor. He will come and he will assess your mood level, okay, and your uh, ability to make the right decision. By that time, uh, by by till that time, you have to stay to the hospital doctor. Then she will flare up, might be again. She will say, "I'm a mad." No, no, you are not a mad. I'm not saying anything like this. I appreciate, but you are in a stressful condition right now, and the psychiatric assessment is very important in your case for two reasons. One is I cannot allow you to go without the psychological assessment. This is number one. This is my legal binding. I cannot allow you to go, number one. Number two, the psychiatrist doctor will help you, will give you some therapies to make you calm. Okay, so these are the two important things. No, doctor, I want to go now. I'm sorry to tell you, I will detain you as per Medical Act 51B. I will detain you for 24 hours to 48 hours. I'm sorry to tell you, you cannot go until seen by the until seen by the psychiatrist doctor. So this is all hidden agenda about this. Then she will say, where is this psychiatrist doctor? Doc? Call him now. I want to see him now. Okay. We are going to call him now and he will come as soon as possible. When he will come, he has the busy schedule. He has the different patients. I cannot give you the fixed timing or exact timing. He will be around as soon as possible. So these are all about this case. I think it's clear. Yes, Dr. Nadeem.
Yes, sir, it is clear. Initially, I was thinking that if the patient does not listen to you and she insists that I want to leave and I have to leave,
Yes.
then
Yes.
I had few questions, but in the end you cleared it very well. Thank you very much.
Yeah. One thing is remaining more that I like to highlight now.
But
Uh,
what you
after
told about the
after this.
mental health, yes, yes,
Yeah.
mental health act, you have to detain that person.
Yes.
So that is
Yes.
very
Yes.
important. Thank
Yeah. Very important. Very important. And this is the hidden agenda also. And there are another hidden agenda after this also. So after the psychiatric assessment, what he will do, the psychiatrist, what he will do, he will come and he will check the capacity of the patient. Okay, if she's having the full mental capacity, then the psychiatrist will try to give her some therapy like cognitive behavior therapy or relaxation therapy. Even then, if she says I want to go, then she can sign the Dama or Lama paper and she can go. Then you cannot
you.
stop her. Okay.
So mental capacity assessment is very important in this case, and this is the
Yes.
hidden
In this,
agenda
yeah,
also.
yeah. This is the hidden agenda also.
Okay, thank you. Thank
Okay,
you.
this is one way the scenario is coming, and the scenario is not finished, Dr. Nadeem. The another way the scenario is coming from where you got the paracetamol. For example, this was the nurse in the hospital. Another scenario is coming, and the patient is nurse by occupation. Then might be they will give you a scenario that she is working in your hospital, and she is a nurse.
All right.
So the next question will be, may I know from where you got this paracetamol? you will say it will remain all confidential until this level. If she says to you, doctor, I purchased this medicine from the pharmacy, then the scenario will remain same as before. Clear?
Okay,
But
fine.
if she says to you, doctor, I took this medicine from the hospital medication trolley, do you think now it has changed or no?
It has changed, I think.
Yeah, it has become now additional ethical, legal, and professional complexities will come now. Okay.
Exactly. Exactly, sir.
So now it will not remain confidential. Okay. So what you have to do now, Mrs. Jennifer, I know this is incredibly difficult now, especially as you're a part of the hospital team. Our priority is your team, but we also need to address how this happened. Can you tell me why you took the medicine from the trolley? Okay.
All right.
Taking the medication means it is a serious matter, both for the patient safety in future. Okay, you you may not be able to work as a nurse in future. I'm sorry. Okay, and professional standing is affected. We need to discuss this openly now. Okay, now this is duty of care is coming now. Okay, uh, I have to inform to the nursing supervisor. We have to inform the hospital legal team. Okay. So they may repost you, reallocate you some other place. These are the differences that we have to follow. Okay. And let me highlight the legal issues here. So legal and ethical issues in this scenario is professional misconduct. She took the medicine from the trolley. This is breach of the professional standards according to NMC and GMC guidelines. Hospital policy violation occurred. So potentially disciplinary action will be taken. Disciplinary action will be taken. There will be internal investigation by the hospital, pharmacy, clinical governance team. Okay, and the nursing and the midwife counselor will be involved. And if the misconduct is proven, then we have to report to the GMC. Doctor and nurses must protect the patients by reporting the colleagues at risk. We have to report this. This colleague of our is risky person. Okay. So here, this is one of the scenario where we have to breach the confidentiality. Okay,
Fine.
confidentiality
Fine,
where
sir.
where the public interest or the public at risk, we have to breach the confidentiality. Normally, the patient confidentiality is applies to every patient, but if her actions risks the patient safety, other patient safety, drug deprivation. For example, she took the medicine like 20 tablets she took from the trolley. So at least 10 patients or 5 patients, they suffered on that day. So it is a misconduct. Okay, so reporting is mandatory in such condition. Who to inform? We have to inform to the uh, leader, whoever the leader is, like the nursing in charge, the consultant, everyone should be informed. Like it will be, as we are informing, the incident report will be written, okay? And then the procedure will be, the investigation will start and it will go ahead. Okay, so then the mental health act will be also applicable. She is having the capacity. Why she did this? She was like in a sound mental status or no when she took the medicine from the trolley. Was she in a normal sense or no? So these all will be assessed.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.